So James, I do have to say, I never thought I would be so excited to be able to say, live from the swamp, let's get into the bowels. Right. So healthcare, I've had the opportunity straight out of naturopathic medical school over 20 years ago. I've had the privilege and opportunity to have found functional medicine very early on in my medical training. So I grew up inside of the paradigm of a naturopathic base and the functional medicine applications. So what is so unique about functional medicine? What is it that brings functional medicine doctors together? It's a uniting theme. And so what we are finding on an international and global platform, we are finding that practitioners are tired of the process and the problems that result from looking at the various different conditions that their patients are presenting with and giving them medications to just manage that symptom profile. We are seeing an uprising internationally, a demand from healthcare providers who are asking for training and more knowledge and experience in root cause medicine. So when you look at these different paradigms, naturopathic medicine, lifestyle medicine, integrative healthcare, or functional medicine, the unifying component of all of those different subtypes of this natural healthcare is getting to the root causes. So in functional medicine, you're going to find that one of the most important themes that weaves its way through all these various different treatment platforms for the different types of chronic disease, it is the gut. It's acknowledging and recognizing the importance, as Dr. Tom O'Brien set the stage for our conversation today, from autoimmune disease to rash patterns, skin disorders, dealing with GI disruption, dealing with issues impacting joints and arthralgias. We certainly see that we tune in to the digestive system, and we then, therefore, take a very specific and appropriate course of care that's going to manage those root causes. So if you're seeing a functional medicine provider, you are most likely going to be given a 5R protocol. Those of you who are trained as practitioners in functional medicine, you're going to utilize this approach. And what is so unique about this language? It's that 5R becomes a scaffolding. It becomes a way to hang a very systematic but yet personalized approach to helping someone identify their underlying causes of chronic inflammation or metabolic disturbances or immune compromisations that can be stemming from the gut. So in an approach that a practitioner would be taking, or those of you who are with us that do functional medicine, you're familiar with the 5R, and this is a very important thing that we're teaching and empowering our patients to acknowledge along the way. So the scaffolding of the 5Rs, what practitioners are then looking very carefully at and identifying are what are certain things that their patients may be exposed to that they need to remove from the diet, their lifestyle, or their environment. So the first of those 5Rs is going to be coming back to remove. You've got to get those factors taken away, get them out of the system. Second, we want to look at the important aspects of normal GI physiologic function and what do we need to do to replace some of those components that may be lost or depleted due to their diet, their lifestyle, or their stress, right? Because if we're talking about gut, we're going back to the stress modification response patterns. And I don't know, do any of you have stress? And it is pervasive. In my patients that come in the door who are dealing with GI complications, it is a unifying theme. And how many people will find that when they get stressed out, they need to run to the bathroom? Or they need to stay and hold back and be careful where they go and navigate their course. And how many people do we know, practitioners presenting, patients coming in to say, you know what, I actually have to gauge my day around where the nearest bathroom is. Right? These can be debilitating, challenging aspects. We know that stress and the gut are intimately connected. So we want to look very carefully at what needs to be replaced. What are those important aspects that we can put back in to improve healthy digestive function? Then next, we want to look at all those important biotic patterns that can be present inside of the gut. So when we look at the microbiome, we've got good bugs and bad bugs, and we have various different balance that is important. Again, so many of us have heard over the years that technically we are humans living on top of the trillions of gut bugs that live in our system, right? We're borrowing them, right? We have this fingerprint inside of our digestive system that uniquely identifies each and every one of us based on that microbiome. Now that's pretty remarkable, isn't it? That your stool sample now is a fingerprint. Wow, right? Wow. Right, so one of the things we're going to do is we're going to re-inoculate. We're going to make sure that we're getting those adequate, good probiotics. We want to feed those good bugs as well. So in the same approach, it is key to repair the tissue. It was a wonderful overview that Dr. Tom O'Brien gave us. And what about that video looking at the leaky gut and that intestinal permeability? Right, so in our 5R approach, there's going to be this next step of repair. We want to make sure that we're repairing that intestinal permeability component. And then last, rebalance. What do we need to do to look at our lifestyle, to look at all those various different factors from our sleep, our stress, our resilience, our exercise, and our movement? What are some of these other important factors that we want to bring on board to help soothe and ease and comfort and bring balance to our autonomic nervous system? So this is the overview of the 5R. Now, if we're looking at remove, what does that mean? What are the types of things that we would need to remove? Well, we commonly are going to turn to food. We're going to look at what are triggering foods. The triggering food families may fall into a category that's called a food intolerance, a food sensitivity, or potentially a food allergen. So we've got 3 different types of reactions or ways in which the body can identify, see a food, and know it doesn't like it, and create some type of an immunologic cascade that can result in that intestinal permeability or leaky gut syndrome. And then also, there's the pathogenic or commensal or abnormal bacteria that we want to pay close attention to. We want to remove environmental exposures, environmental toxicants, or other key factors that could be there complicating the scenario. And then again, you're going to hear over and over and over again, when you're dealing with dysfunctional regulation in the gut, we've got to look very carefully at those origins of stress. So I'm just going to ask you, when you think about the various different stressors in your life, what's the number one stressor that you have right now today in your life? Capitalism, interesting. Live from the swamp. All right. When you think about the stressors in your life, can you do anything about it? Can you control the stress? Do you have the option? Or is it a stressor that's out of your control? Right? Sometimes it's out of our control. Sometimes it's in our control. That's an important step. And therefore, what can we do in that environment where it's a stress out of our control? What we can do is we can control and support the way we respond to that stress. All right, so we have stressors and we have our response to stress, both which are very key elements of analyzing these deep roots and these deep sources. So there's going to be all kinds of clinical approaches that may be appropriate for each and every patient. So the functional medicine practitioner is going to take that opportunity to figure out what is unique to you. What is it that we need to remove for your scenario? Then we want to move into replace. We want to make sure everything's working well from the top of the tube all the way down. So we're going to be looking at some of the aspects that relate to chewing, taking the time to slow down and chew. So many people eat on the go and they swallow their food too quickly. So slow down, be mindful. We're going to replenish those factors that relate directly to the multiple different cascades that trigger appropriate digestive function. Then we want to re-inoculate. We want to put those good bacteria back in and allow for them to continue to move through the system. We want to feed those good bugs. Here's where we need fiber. Here's where we want to look at those probiotics and the prebiotics. And that combination brings us forward in this way in which the gut turns on a whole new cascade of signaling. Right? How many of you are taking some form of a probiotic every day? Right? Grateful. My parents have got all 4 of my kids tonight. They're live on the show with us tonight. This is why you're taking probiotics. Right? This is why we're doing this. So every few days, everybody gets a little bit of probiotics, especially in this particular season, right? When we know we're going to be meeting all kinds of different immunologic factors. And then repair. We've got to heal this leaky gut. There are many approaches that can be given. Often you're going to find us through diet and nutrition applications. We're going to use different types of formulas, powders, combinations that will help heal that paradigm shift that had been going on in the gut to repair that tissue and move forward. So this schematic sums it all up. It really ties together the pieces that Dr. O'Brien opened up. Now we know there are many different triggers that set intestinal permeability into motion, right? And each and every patient is going to have their unique subset of triggers. So we're working our way through the 5R, but personalizing each and every step to make sure we know what's unique and right for that patient. Because the downstream impact of that altered microbiome and that intestinal permeability is going to be food reactions. It's It's going to be challenges with nutrition absorption, and we're going to end up with cascades of endotoxemia, or internal toxin production, coming out of our own gut and digestive system, and that's where our chronic systemic disease is rooted. So when we say all chronic disease and inflammation starts in the gut, it's going to manifest differently for different patients. Sometimes it's going to come out in the skin. Sometimes it's going to be swollen joints. Sometimes we're going to feel it in chronic pain patterns, or headaches, or fatigue syndromes. So when going back to the root causes, it's not just about what you're taking to heal up the intestinal permeability issue, it's making sure from the top down, all the way through the system. We're taking the time to very carefully and adequately bring that antibody load down and inflammatory load down. So in closing, I want to emphasize the importance of mindfulness and our choices in what we're eating, how we're eating, and the moments that we're eating. Slowing down, taking just those moments every day, even if it's just a minute, 2, 3, 4 times a day, to breathe and relax and center and retrain ourselves to come back into a healthier autonomic balance and find that point in between. So thank you for your time. You know you've seen a functional medicine practitioner when your respect and your relationship with the loo has changed. So thank you very much, James.
Kristie Hughes.
Good job.